Okay, طبعا we have the number 5 and number 7. okay, nerve ما تكلمنا عليهم because we will take them after the break. okay, بناخذ هذول بعد البريك لأنهم مهمين لنا, as this for a teeth, as this for a facial expression. okay, so we goes to the cranial nerve number 9, oh sorry 8. okay, number 8, which is called it vestibulo cochlear. Vestibulo for the balance, cochlear for hearing. okay, زي ما قلنا وظيفته في البالانس التوازن والhearing. okay, conduct equilibrium which is the balance اللي هو التوازن, add auditory sensation اللي هو السمع to the brain, so it's sensory, so it's take from the ear to the brain. okay, formally called the auditory nerve or acoustic nerves. okay, auditory or acoustic كلها بمعنى انه الصوت. okay, it's mean of hearing. the sensory function is okay, وظيفته ايش, as we said it's for equilibrium and hearing. so the vestibulo or the vestibular branch conduct impulse for equilibrium, هو عبارة عن two nerve combined together as vestibulocochlear. okay, فعندنا vestibular nerve and cochlear nerve. the vestibular nerve وظيفته equilibrium, as the function is equilibrium or the balance. okay, اللي هو التوازن, عشان كذا ما تطيح ما تدوخ. so equilibrium and balance means that you can move normally, you don't have any dizzy, you don't have any coma and those other things. okay, cochlear is a branch conduct hearing. okay, this is the function. so as you remembered from the first introduction, ذكرت أول مقدمة, you will understand everything I will say. so this is the vestibulocochlear nerve, this is the cochlear. okay, this is the cochlear and this is the vestibular. okay, so it starts from here. This, as we said, is cochlear and it's for hearing, and this is the vestibular branch and it's for balance, and both of them goes together through the internal acoustic meatus. okay, and together as one nerve called vestibulocochlear nerve. okay, في عندنا نرفين هو cochlear for hearing, vestibular for balance. okay, so that you can move normally. okay, origin, it's sensory. so the vestibular branch is from hairy cells in the vestibular of the inner ear. cochlear is a branch cochlea in the inner ear. okay, مصدرهم وين, من مكان الإحساس ومن مكان البالانس. okay, لو لاحظتوا هنا here this is the vestibular in the inner ear, هذا المكان كله الكبير هذا اسمه inner ear. okay, this whole place is called inner ear. so we have the vestibular cells here in the vestibules is for balance, so it's take the balance, the sensation balance to the central nervous system, and cochlea is taking the hearing in the inner ear to the central nervous system. as I said, if you can remember that sensory is from the place to the central nervous system, and the motor from the nervous system to the center, and the sensory and the motor from the central nervous system to the target. okay, this is the origin. okay, if this nerve is damaged, what's will going happen? قولوا لي انتم الان اذا هذا العصب حصل له مشكله ايش ممكن تصير من مشاكل؟ يلا حابب مشاركاتكم, علقوا لي تحت. اذا حصل if this nerve is damaged, what's problem we can face? اذا حصلت مشكله ايش المشاكل اللي ممكن احنا نواجهها؟ اوكي, حلو, loss of hearing, فقدان السمع. اوكي, good. اوكي حلو حلو. ديزني اللي هو الدوخة وعدم الارتياح وكذا. حلو. vomitings كويس. اتمنى تعلقوا لي اللي يرسلوا في الخاص. اوكي اوكي في التعليقات. سلام. كويس كذا انتوا تبينون انكم فاهمين. اوكي. If the lesion in the vestibular which is for balance, so basically you will lose the balance لانه هو حق التوازن، انت will lose the balance. nausea لانه بيحصل عندك زي الدوخة فبيصير عندك nausea غثيان or vomitings اللي هو التقيؤ and dyspnea or dizziness. okay. But if the lesion in the cochlear branch إذا كان في cochlear which is for hearing, so it's result for loss of hearing راح تفقد السمع which is a medical term called deafness. okay. Deafness is a medical term used for loss of hearing.